Hello, I'm Dr. Dennis McKenna. I'm joined today with Fran Spreer Albert. Fran, it's great to have you here.
Thank you for having me back. Happy to be here.
Been here a bunch of times. Fran, of course, is our System Chief Financial Officer, our System Chief Operating Officer, and we're giving you the update from Albany Med. Today is Monday, September 15th. All right, so Fran, obviously, we introduced you. You've been here before. We appreciate you being here.
Love coming here.
Just to remind people of your role here in the health system, you want to describe the two different specific areas, finance and operations, that you're responsible for?
I am happy to do that. So as Chief Financial Officer, I'm responsible for areas such as financial reporting, budgeting, payroll, all of those classic finance roles that you would think of. As the Chief Operating Officer, I'm responsible for those support operations, all of those daily functions that all of you clinicians need to support what you do for our patients, what you do for our students each and every day. So that includes areas like human resources and facilities and space planning, security, keeping us safe.
Very good, very good. Thank you for that. I'm now going to ask you a question that I know you know the answer to, which is how many years have you been at Albany Med?
25 years.
You have, because last week we had our 77th edition annual of the 25-year club.
So much fun.
It was. And it was at the Marriott on Wolf Road, back in person again for the second year. We, unfortunately, during COVID, were not able to do the big events, but we're doing them again.
Absolutely.
And you were part of a class that got inducted in that started their career at Albany Med in the year 2000. So you've been here 25 years, and there were 68 total who were inducted into that class. It was lots of fun.
It was such a great night, always warm, and it's so wonderful to see many who have retired, and even all of our current employees just having a great opportunity to celebrate together.
Yeah, a couple thanks. I want to start with Karen Newton and the entire Human Resources team. Did a wonderful job putting it together.
Outstanding.
We had the lovely voice of Deidre Michael, right?
She is so
she did
talented.
A wonderful job. Chaplain Marvel gave some beautiful remarks, and obviously it was just wonderful to see everybody there in person. So I think we had 6 employees there who have worked at Albany Med for more than 50 years.
Amazing.
So it was lots of fun. So congratulations on your 25 years.
Very proud.
Very good.
And grateful.
Very much so. And you made some lovely remarks about what it
Thank
meant
you.
to you to be an employee here for 25 years, and people thought that was very impactful.
Thank you. I'm blessed.
Yeah, for sure. So this week is our employee celebration, another event that we're so glad to be able to do again. I know we started it up again last year the way we had done in the past. It was a huge success last year. And we're doing it again. So here's the dates. On the main campus, it'll be this Thursday, September 18th, 1275 Broadway.
Yes.
The next day, Friday, September 19th, Brooks Barbecue.
Yummy.
Yummy.
Always good.
11 to 2. And I hear there's some giveaways this year.
Some good ones.
Yep. So we're not going to talk about that, but get there so you can get your Brooks Barbecue, get your giveaway. On the main campus, where's it going to be? Well, let's describe it as the parking lot behind the college.
Yes, same place as last year.
And then obviously at 1275, it'll be
in the picnic area, which is beautiful as well.
So please come out. And first of all, thank you to our entire team that puts it together. It's a lot of work. The workforce really enjoys it, and we appreciate the effort of the volunteers to put that group together. And after we're done, we'll make sure we have the names of the people who helped organize that. Another advantage of going to that is you can get your flu shot there.
Yes.
So
really convenient.
Yeah, if you're inclined to get it, you can get it there. You will need to have it by December 2nd. If you are unable to or don't necessarily want to get it at the actual employee celebration, look on the internet. There'll be other times and places where you can get that as well. So we're looking forward to that.
We are. See you there.
Fran, people have heard that we are in the middle of an engagement called Transformation Project. We're partnering with a healthcare consulting firm called ECG. Take a moment, if you would, just briefly and describe, what that is, why we're doing it, and where we're at.
Absolutely. So if you think about the last decade for our health system and all the work that you have all accomplished, we built a system. We put in Epic, we put in Workday. We've been working very hard to integrate so many different clinical and support functions. We completed our first strategic plan as a system. Now what we're doing is looking forward to the next 10 years and thinking about how do we best sustain, grow, and become the best we absolutely can be. So there's 3 major work streams. Dr. McKenna leads the strategic planning work stream. So that's our 10-year vision. Where do we want to be? How do we want to grow? And then we have our health system organization work stream. Dr. Boulos is leading that.
Right.
And that's all about sustaining and growing our academic and research missions, as well as aligning our physicians to make them have the maximum impact on our communities. And then I'm leading the corporate services stream, and that's to ensure that we have all the right support services to support the strategy and to support the physician mission, vision, and values.
Fantastic. So many of you have probably been involved already. Surveys, interviews, site tours, sitting on different task force and committees. More work to come.
Yes.
But it's fun and it's exciting work.
It is exciting work, and it'll involve, as you said, so
Right.
many of us across the entire system.
All right, thank you very much, Fran, for that. Okay, let's switch over. Now I'm going to ask you another question that you don't know the answer to, but I bet you'll get it right. What would you say is the most important asset inside our health system?
Workforce.
Workforce. I knew you would say that, for sure. To that end, I know you charged a task force with getting together, trying to figure out how we can identify smart, hardworking, talented, mission-driven people and bring them in, and not only bring them in, but get them hired and get them working as quick as possible. So talk about the vision of that task force. Talk about how people can help with that.
Oh, I am happy to. So as Dr. McKenna said, workforce, number one, and we are looking to increase our numbers and have more teammates focused on all the same goals that we work on every single day. So this task force is multidisciplinary. We have people from HR, we have people from RevCycle, we have all sorts of clinical representation, nursing, and other techs. And what we're looking to do is find the best ways to attract people to join us, to join our team, and what are the best practices in terms of onboarding them very quickly and smoothly and in a way that's not as burdensome from a work standpoint, and how do we interact with those teammates from day one so that they know they're part of something bigger and that they want to stay with us for the maximum length of time that they can. And the team is really doing some great work. So we have people very openly and honestly sharing what hasn't worked well for them with respect to our processes and what types of tools do they have, but maybe they don't know how to use them. And we have other people coming to the meeting who've been tremendously successful, and they're helping give tips and saying, okay, here's how I get through it, and here's how I interact with my team. So a lot of good ideas coming out. You'll see lots of tip sheets and best practice materials that you can share and use amongst your team.
That's very exciting. I mean, so some people watching this may say, well, I'm not an HR, I'm not a hiring manager. How does this affect me? I would begin by saying we all should look to identify and encourage people to join our team if they're people that you want to be part of it, right? So
exactly.
The best ambassadors for joining the health system or to work at Albany Med are people who work here today.
Yes.
So that's a role you can play. Encourage people that you want to join our team. Then creating an environment, a culture when people are interviewing that say, you know what, you want to be part of this.
That's exactly right.
And then ultimately there are people who are responsible for some of the individual steps in that hiring process because we have to do it right. We have to make sure that we do a health screen, a security background check, make sure the paperwork's
and
filled
they're
out.
part of the task force
And
as well.
so we want to be sure everyone kind of moves that through so that we can get people here and be part of what we're doing as soon as possible.
Exactly. And never hesitate to reach out to people and tell them how great your experience is and that you would love to have them join you.
Yeah.
I enjoyed pointing out to people, if you look at my direct reports, half of them were not looking for a job when I called them.
That's right. And here
they're
they are.
Great hires and great teammates.
And one of them celebrated a 25-year club
Yes,
last night. Michelle. All right, two last items. DNV, Comprehensive Stroke Center accreditation, certification, incredible. Just another differentiator for the type of care that we deliver here at Albany Med. I would be remiss if I left off any particular department or division, clinical or non-clinical, that made that happen. Let's just say it takes a lot of people in a lot of different areas to deliver comprehensive stroke care. And we were told that we do it, and we do it as well as anybody does it in the country. And so I want to congratulate the team for that remarkable achievement.
So impressive. And
sure.
yes, congratulations.
And we'll end on another congratulations. Very exciting announcement last week. Dr. Jason Mouzakis, who is the hospital general director, announced that we have now appointed as our chief nursing officer, Megan Keenan.
Yes, so happy for her.
Yeah. I've had the opportunity to interview Megan in the past for one of our Inside Albany Med videos. Her story is very inspirational to me.
Is.
Started as an ASA, LPN, worked in the research department, went back, got her baccalaureate in nursing, went and got her master's, got her DNP. All the time she was going through all those different levels, stayed here at Albany Med, moved up through the organization with the different responsibilities, clinical, research, administrative, leadership. Yeah, she is somebody who I think the frontline nursing staff supports and is supportive of, and I think there'll be a huge opportunity for her and her entire team really to take us to the next level when it comes to nursing care at Albany Med.
I agree. We are so lucky. And I described to her in a conversation that Megan and I had that everybody that I work with, I learned from. And there's characteristics about them that I emulate. Your courage is one I emulate in you, one of many. And with Megan, what I described to her is her level-headed, calm, mature approach to the most complex and situations, and I'm just so impressed by that.
Very good. Thank you for that. Appreciate that. All right, well, it's wonderful to have you here today, and thank you for the opportunity to join us in the updates.
Thank you for having me.
And we'll see you at the picnic.
Yes, I will be there.
And both on the Albany campus as well as down at 1275 Broadway. And obviously, it's a beautiful fall season. We know that many of you are continuing to come in and work here over the weekends, and we appreciate your effort here now more than ever. And we'll be back again in 2 weeks. And we ask that you once again, please take care of yourself and take care of each other.